A renowned ER doctor and health policy expert has sounded the alarm, drawing parallels between President Trump's government shutdown rhetoric and the dark history of eugenics. Dr. Craig Spencer, an influential lecturer at Brown University, warns that the administration's language echoes a disturbing policy from the 1920s, where people were categorized based on their worthiness, under the guise of state-sanctioned acceptability. The shutdown, now in its fourth week, has become a battleground for funding and immigration policies. While the White House demands cuts and concessions, Senate Democrats fight for the extension of healthcare subsidies and the reversal of recent healthcare cuts. Dr. Spencer sees a dangerous resemblance to the eugenics movement of the early 20th century, where race science was used to justify sterilization and restrictive immigration laws. He argues that Trump's government echoes this past, especially in its discourse on immigration, healthcare access, and who deserves government support. It's a slippery slope, Spencer told the Daily Beast. The logical endpoint, though they may not say it aloud, is allowing certain people to die. Spencer, with his extensive experience in emergency care and his work with Médecins Sans Frontières, believes the shutdown fight is symptomatic of a larger issue in Trump-era health policy. He highlights the deep federal cuts and stricter eligibility rules, which he says are part of a pattern to limit access to healthcare for those who need it most. The politics fall apart at the bedside, Spencer says. As an emergency physician, my job is to treat the emergency, not question immigration status or insurance coverage. Despite the political rhetoric, federal law mandates that emergency rooms provide treatment to all, regardless of their ability to pay or immigration status. The Emergency Medical Treatment Labor Act, MTLA, ensures that participating hospitals must screen and stabilize anyone who seeks care. When pressed on this issue, White House Press Secretary Karoline Leavitt dodged the question, instead focusing on immigration talking points. However, Speaker Mike Johnson later clarified that Republicans do not intend to change the EMTLA, emphasizing that emergency care is provided without question to all who need it. It's a matter of life and death, Johnson said. If someone is hemorrhaging and shows up at the ER, they get treated. That's the law, and we support it. As the shutdown continues and the White House pursues workforce cuts, emergency rooms become the front line where political rhetoric meets real-life consequences. I will not stop resuscitating someone because they're undocumented, Spencer vows. We will do right by every patient, no matter their status or ability to pay. That's our oath. The White House and Department of Health and Human Services have not responded to requests for comment.